Hello and welcome to Learning English Pro. I'm Jer, your online English teacher, and today we're diving into the ultimate guide for nurses, 500 essential phrases to help you communicate confidently in any healthcare setting. In this masterclass, I brought together 7 lessons covering everything from everyday patient care and emergency situations to mental health support and delivering difficult news. Each section is chaptered with timestamps in the video description so you can easily jump to the parts you need. For my student members, there's an exclusive PDF guide with all 500 phrases ready for download on the Community tab. If you'd like to join as a member and get access to the guide, early video releases, and so much more, you'll find a link in the video description below. Thanks for being here with me at Learning English Pro. Let's dive into our first lesson and make your nursing communication clearer, compassionate, and confident. I'm delighted to bring you this English lesson where you'll learn 100 English phrases for nursing. In this lesson, we'll cover 100 useful phrases divided into topics such as patient admission, taking vital signs, medication administration, patient care, wound care, patient education, communication with doctors, emergency situations, and discharge instructions. These phrases will help you navigate various scenarios with confidence and clarity. And our first topic is patient admission. Welcome to our facility. How are you feeling today? Welcome to our facility. How are you feeling today? Can you please fill out this form? Can you please fill out this form? Do you have any allergies? Do you have any allergies? What brings you here today? What brings you here today? Can you describe your symptoms? Can you describe your symptoms? Do you have any existing medical conditions? Do you have any existing medical conditions? Are you currently taking any medications? Are you currently taking any medications? Have you been hospitalized before? Have you been hospitalized before? We need to take your vital signs. We need to take your vital signs. Please provide a sample of your urine. Please provide a sample of your urine. Well done, that's 10 phrases learnt already for the world of nursing. Next up, let's take a look at some phrases relating to taking a patient's vital signs. I need to take your blood pressure. I need to take your blood pressure. Please roll up your sleeve. Please roll up your sleeve. I'm going to check your temperature. I'm going to check your temperature. Let me measure your pulse. Let me measure your pulse. I need to listen to your heart and lungs. I need to listen to your heart and lungs. Please breathe in and out slowly. Please breathe in and out slowly. Your vital signs are normal. Your vital signs are normal. Your blood pressure is a bit high. Your blood pressure is a bit high. Your temperature is elevated. Your temperature is elevated. I need to record your oxygen levels. I need to record your oxygen levels. Now it's time to move on to our third topic, which is medication administration. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Please take this pill with water. Please take this pill with water. Do you have any difficulty swallowing pills? Do you have any difficulty swallowing pills? This injection might sting a bit. This injection might sting a bit. I'll need to give you an IV. I'll need to give you an IV. Are you experiencing any side effects? Are you experiencing any side effects? This medication should help with your pain. This medication should help with your pain. Make sure to take this with food. Make sure to take this with food. Let me know if you feel any discomfort. Let me know if you feel any discomfort. It's time to move on to our next topic, which is patient care. How are you feeling today? How are you feeling today? Do you need help with anything? Do you need help with anything? Are you in any pain? Are you in any pain? Can you rate your pain on a scale from 1 to 10? Can you rate your pain on a scale from 1 to 10? Let me help you sit up. Let me help you sit up. I will assist you to the bathroom. I will assist you to the bathroom. Do you need help changing your clothes? Do you need help changing your clothes? Let me adjust your pillow. Let me adjust your pillow. Would you like a blanket? Would you like a blanket? Can I get you anything to drink? Can I get you anything to drink? We are already on our 5th topic, wound care. I need to change your dressing. I need to change your dressing. This might hurt a little. This might hurt a little. I'm going to clean the wound now. I'm going to clean the wound now. We need to keep this area dry. We need to keep this area dry. Please try not to touch the wound. Please try not to touch the wound. The wound is healing nicely. The wound is healing nicely. I'm going to apply some antibiotic ointment. I'm going to apply some antibiotic ointment. You may feel a bit of pressure. You may feel a bit of pressure. I will bandage this up for you. I will bandage this up for you. Let me know if it starts bleeding again. Let me know if it starts bleeding again. We are halfway through our English lesson on phrases for nurses. Next up, our topic is patient education. It's important to take your medications as prescribed. It's important to take your medications as prescribed. You need to follow a low-sodium diet. You need to follow a low-sodium diet. Regular exercise is beneficial for your health. Regular exercise is beneficial for your health. Make sure to stay hydrated. Make sure to stay hydrated. Here's how to manage your condition at home. Here's how to manage your condition at home. Always wash your hands before eating. Always wash your hands before eating. Avoid smoking and excessive alcohol consumption. Avoid smoking and excessive alcohol consumption. Monitor your blood sugar levels regularly. Monitor your blood sugar levels regularly. This pamphlet contains useful information. This pamphlet contains useful information. If you have any questions, don't hesitate to ask. If you have any questions, don't hesitate to ask. Our seventh topic is communication with doctors. I need to update the doctor on your condition. I need to update the doctor on your condition. The doctor will be in to see you shortly. The doctor will be in to see you shortly. Let me check with the doctor about that. Let me check with the doctor about that. The doctor has prescribed a new medication for you. The doctor has prescribed a new medication for you. I need to report this symptom to the doctor. I need to report this symptom to the doctor. The doctor has ordered some tests. The doctor has ordered some tests. I will consult with the doctor about your treatment. I will consult with the doctor about your treatment. The doctor has requested a follow-up appointment. The doctor has requested a follow-up appointment. I'll inform the doctor about your pain. I'll inform the doctor about your pain. The doctor will review your test results. The doctor will review your test results. In our next topic, we will take a look at phrases you can use in an emergency situation. We need to act quickly. We need to act quickly. Stay calm, we are here to help. Stay calm, we are here to help. Call for emergency assistance. Call for emergency assistance. I need to check your vital signs immediately. I need to check your vital signs immediately. Please follow my instructions. Please follow my instructions. Are you experiencing chest pain? Are you experiencing chest pain? We need to start CPR. We need to start CPR. The defibrillator is on its way. The defibrillator is on its way. I need to stabilize you before the doctor arrives. I need to stabilize you before the doctor arrives. You are in good hands. You are in good hands. Let's move on to our penultimate topic, discharge instructions. You are ready to be discharged. You are ready to be discharged. Here are your discharge papers. Here are your discharge papers. Make sure to follow up with your primary care physician. Make sure to follow up with your primary care physician. These are your home care instructions. These are your home care instructions. Take your medication as directed. Take your medication as directed. Schedule a follow-up appointment. Schedule a follow-up appointment. If you experience any complications, contact us immediately. If you experience any complications, contact us immediately. Keep the wound clean and dry. Keep the wound clean and dry. Avoid strenuous activities. Avoid strenuous activities. Thank you for choosing our facility. Thank you for choosing our facility. It's time to move on to our final topic for this lesson, general courtesy. How can I assist you today? How can I assist you today? Please let me know if you need anything. Please let me know if you need anything. I'm here to help you. I'm here to help you. Your comfort is our priority. Your comfort is our priority. Thank you for your patience. Thank you for your patience. I appreciate your cooperation. I appreciate your cooperation. We aim to provide the best care possible. We aim to provide the best care possible. Feel free to ask any questions. Feel free to ask any questions. I will be with you shortly. I will be with you shortly. Have a great day. Have a great day. Well done, you've learned 100 new phrases. These phrases should help nurses in their daily interactions and ensure clear, effective communication with patients, doctors, and other healthcare staff. Today's lesson is 100 English phrases for nurses in emergency situations. In this video, I'll walk you through key phrases you need to communicate effectively in high-pressure medical settings, whether you're triaging patients, stabilizing them, or working with your medical team. Let's get started on our 100 essential phrases for nurses in emergency situations. In an emergency, one of the first things a nurse must do is assess the severity of a patient's condition. These phrases will help you triage patients quickly and efficiently. What is your name and date of birth? You can use this question to establish basic patient information. What seems to be the problem? This is a direct way to ask the patient why they're seeking emergency care. Are you in any pain right now? Where does it hurt? This phrase can be important for identifying areas of pain. On a scale of 1 to 10, how severe is your pain? We say this to assess the intensity of pain, which helps to prioritize treatment. When did the symptoms start? Knowing the timeline is crucial for diagnosing the urgency of the condition. Is this the first time this has happened? This helps understand if it's a recurring issue or a new event. Are you allergic to any medications? Allergies are considered critical information when planning treatment. Are you taking any medications currently? This question helps avoid drug interactions during treatment. Have you experienced this kind of pain before? Identifying patterns can assist with diagnosis. I'm going to take your vital signs. This is basic communication when starting an initial assessment. Once the assessment is complete, stabilizing the patient is the next critical step. Here are key phrases for communicating with the patient and team during stabilization. I'm going to give you some oxygen to help with your breathing. We need to start an IV to administer fluids. We need to start an IV to administer medications. Please stay still while we put on the neck brace. This phrase is useful when dealing with spinal injuries or trauma patients. I'm going to elevate your legs to improve blood flow. You're doing great. Try to take slow, deep breaths. This phrase is great for offering reassurance to a panicked patient. We need to monitor your heart rate closely. I'm going to check your blood pressure now. Let us know if the pain gets worse. This phrase encourages communication about any changes in pain levels. We're going to move you to a more comfortable position. This phrase can help keep the patient calm during movement. Stay with us, you're in good hands. This phrase can offer emotional support during a critical moment. Clear communication with the medical team is essential to providing effective care. Here are phrases that nurses use to communicate with doctors and other healthcare professionals in emergency situations. The patient is experiencing severe chest pain. We need to order an urgent EKG. The patient is hypotensive. Blood pressure is 85/50. We're prepping the patient for intubation. Could you assist with starting the IV? I've administered 2 milligrams of morphine for pain. The patient has a history of asthma. We need to monitor their breathing closely. Can we arrange for a portable X-ray? The patient's oxygen saturation is dropping. Let's get the crash cart ready just in case. In cases of cardiac arrest, fast and clear communication is vital. These phrases are useful for communicating with your team when a patient's heart stops. We have a code blue in room 3. This is the emergency alert for cardiac arrest. Begin CPR immediately. Get the defibrillator. Charging to 200 joules. Clear. Check for a pulse. Administer epinephrine 1 milligram. Continue chest compressions. Switch every 2 minutes. I'm going to secure the airway. Let's check the heart rhythm again. We have a pulse. When a patient is struggling to breathe, nurses need to act quickly and communicate clearly. These phrases will help you manage respiratory distress. I'm going to put you on oxygen to help your breathing. We can say this phrase to offer reassurance to the patient while applying oxygen. Take slow, deep breaths for me. With this phrase, we are coaching the patient to control their breathing. I'm going to check your oxygen levels now. It's important to keep the patient informed. We need to start nebulizer treatment. Let me know if it's harder to breathe. I'm adjusting the oxygen flow rate. We need to prepare for intubation. I'm going to take a blood gas sample. A blood gas sample is used to assess the patient's oxygen and carbon dioxide levels. The patient is cyanotic. We need to act quickly. Cyanotic is the blue discoloration on skin due to lack of oxygen. We're getting you into a comfortable position to help your breathing. You can use this phrase with a patient to let them know you're repositioning them to alleviate distress. Trauma patients require quick thinking and clear instructions. These are key phrases for managing traumatic injuries. Where does it hurt the most? We use this question for identifying the primary site of trauma. We need to stabilize the fracture before moving. I'm applying pressure to the wound to stop bleeding. By using this phrase, you are communicating the wound care steps. We're going to roll you over carefully. With this phrase, you're preparing a patient for movement. We need to immobilize the neck to prevent further injury. This phrase is useful for when you're dealing with a spinal trauma. The patient is losing a lot of blood. Let's start a transfusion. This is something you might say to a colleague to initiate the life-saving treatment. I'm going to apply a tourniquet. A tourniquet can be used in cases of severe bleeding. We need to monitor for signs of shock. Is there any numbness or tingling in your limbs? This question to a patient can help identify nerve damage. We'll be taking you for an X-ray to check for fractures. During emergencies, nurses often need to communicate with family members who are anxious or frightened. It's important to be clear, calm, and compassionate when delivering updates. Your loved one is stable at the moment, and we are closely monitoring their condition. This phrase offers reassurance to family members while giving them an update. We're doing everything we can to help them. With this phrase, you're offering comfort during critical moments. It's a critical situation, but they are receiving the best possible care. This is a balanced way to acknowledge the seriousness of a situation while offering reassurance. We will let you know as soon as there's any change in their condition. This is letting the family know that they'll be informed of updates. I understand this is very difficult, and I'm here to answer any questions you may have. With this phrase, you're providing emotional support and encouraging dialogue. The doctor will speak with you shortly to give you a more detailed update. They are responding well to the treatment so far. With this phrase, you are sharing positive news. We are going to run some tests to better understand their condition. Please wait here and I'll come back with more information as soon as I have it. With this phrase, you're guiding the family on where to stay during the process. I know this is overwhelming, but we are doing everything we can. With this phrase, you're acknowledging the family's emotions while offering reassurance. Administering medications and managing IVs is a critical part of emergency care. It's important for nurses to explain these procedures clearly directly to patients. I'm going to start an IV to give you fluids. I'm going to start an IV to give you medication. This medication should help ease your pain. We're going to give you some antibiotics through the IV. Please keep your arm still while I insert the needle. Let me know if you feel any discomfort. The IV fluids will help stabilize your condition. I'm administering the pain relief now, and it should start working shortly. Can I check your IV site to make sure everything looks good? I'm going to switch your IV to a different medication. You may feel a bit of a sting. Let me know if it becomes painful. Nurses may encounter patients in mental health crisis, requiring them to de-escalate situations and provide calm reassurance. Here are essential phrases to handle these sensitive scenarios. You're safe here. We're here to help you. With this phrase, you're reassuring the patient that they are in a safe environment. Can you tell me how you're feeling right now? In a difficult situation, it's important to open up communication to better understand the patient's mental state. Try to take some deep breaths and focus on calming down. With this sentence, you're guiding the patient through calming techniques. I understand that you're upset, but we need to work together to help you feel better. With this phrase, we're acknowledging the patient's emotions while offering a path forward. We're going to do our best to make you feel comfortable. This phrase is great for offering support and reassurance. Is there anyone you'd like to talk to or contact? It's important to provide the option for the patient to reach out to someone. I'm going to stay with you until things feel more manageable. With this phrase, you're offering your physical presence for reassurance. Would you like to tell me what's been bothering you? With this question, you're encouraging the patient to open up about their feelings. We're here to listen and support you. You're not alone. With this sentence, you're providing emotional support and validation. Let's focus on getting you the help you need. This positive phrase helps by directing the patient's attention towards positive actions. After an emergency situation has stabilized, nurses often need to provide aftercare and discharge instructions to patients. These phrases will help you guide patients through the next steps. You're stable now, but we'll need to keep monitoring you for a little longer. This phrase helps explain the need for continued observation. You'll need to rest and follow these instructions carefully once you're home. This phrase outlines post-discharge care. Please take these medications as prescribed and let us know if you experience any side effects. With this phrase, you're providing medication guidance and support. Here's a follow-up appointment for you to check in with your doctor. It's important to schedule the patient for the next steps in care. Avoid heavy lifting or strenuous activity for the next few days. This is common discharge advice for certain conditions. You can go home once the doctor clears you. With this phrase, you're letting the patient know what to expect before discharge. If you experience any of these symptoms again, come back immediately. This statement provides emergency readmittance instructions. We'll give you a summary of your treatment and instructions to take home. This phrase covers explaining post-care paperwork. Make sure you drink plenty of fluids and get lots of rest. This phrase offers more basic aftercare tips. You're all set. Take care and let us know if you need anything. This phrase can be your final discharge communication with a patient. And that's it for today's lesson on 100 key phrases for nurses in emergency situations. Hello and welcome to Learning English Pro. I'm Jer, your online English teacher and guide. Today's lesson is dedicated to a sensitive but crucial topic in nursing, palliative care. Palliative care is all about providing relief from the symptoms and emotional stress of serious illness. It requires not only technical skill, but also compassionate communication with patients and their families. Our first section is introducing patients to palliative care. This first set of phrases will give you communication skills to introduce palliative care to patients and their families. These phrases will help explain the purpose of this care and what they can expect. Palliative care is focused on improving your quality of life by managing symptoms and providing emotional support. This phrase keeps the focus on comfort and support to ease any concerns about the term palliative. We are here to ensure that you feel as comfortable as possible. This phrase reassures the patient that the goal is comfort, which is often a top concern. Palliative care can help manage your pain and other symptoms to help you live as well as possible. Here we are emphasizing the positive impact palliative care can have on the quality of life. Our team will work closely with you and your family to create a care plan tailored to your needs. Including the family in care discussions can help everyone feel involved and reassured. Palliative care is not just for end-of-life situations. It's about managing symptoms and providing relief at any stage of illness. Here we can clarify that palliative care is not synonymous with end-of-life care, which is a common misconception. We will focus on what matters most to you and your family. Personalizing care helps the patient feel understood and supported. This type of care focuses on your physical, emotional, and spiritual well-being. With this phrase, we are highlighting the holistic approach that palliative care offers. We are here to help you and your family cope with the emotional challenges of your illness. Here we can emphasize emotional support, as patients and families often need reassurance. Our goal is to reduce pain and improve your overall comfort so you can focus on spending time with loved ones. Focusing on comfort and quality time can ease patient anxiety. Palliative care is about living as fully as possible, even with a serious illness. This phrase reframes palliative care as something positive and life-affirming. Next, we'll go over phrases you can use to help patients understand and cope with the changes that may come with palliative care. You may notice some changes in your energy levels, but we will help you manage those. Here we are acknowledging changes while offering reassurance. It's normal to feel more tired or weak, and we'll adjust your care plan to help. Here we are explaining that adjustments will be made to ease discomfort. Your appetite may decrease, and we will monitor your nutrition to make sure you're getting what you need. This phrase helps address concerns about eating, and it can reduce stress for both patients and families. We can provide support with daily activities if you're feeling too weak to manage on your own. Offering help with daily tasks can make patients feel less overwhelmed. You might experience some new symptoms, but we'll be here to help manage those as they arise. You can reassure patients with this phrase. It will help them see that they won't face new symptoms alone. We can make adjustments to your medications to keep you as comfortable as possible. Here we can assure patients that their care is flexible and can adapt to their changing needs. It's important to listen to your body and rest when you need to. Here we are encouraging patients to rest, which can help them cope with fatigue. If certain activities become too difficult, we can offer alternatives to make things easier. Here we are providing solutions that help maintain the patient's independence. You might find that certain treatments are no longer necessary. We can discuss the best plan for your care. Here we can help patients understand that treatment goals may change as their illness progresses. We'll focus on the most important treatments to maintain your comfort and quality of life. This phrase can help reassure patients that the care plan will prioritize their comfort. Now let's look at phrases for explaining palliative care to family members. It's important to communicate clearly and compassionately with the patient's loved ones. We'll work closely with you to make sure your loved one is comfortable. This phrase can help reassure families that they are part of the process. Palliative care can help manage pain and other symptoms to improve their quality of life. This phrase emphasizes the benefits of symptom management. We'll be monitoring their condition closely and adjusting care as needed. Here we are explaining that care is ongoing and adaptable. You can reach out to us at any time if you have questions or concerns about their care. Offer open lines of communication, which can help reduce family anxiety. Our goal is to keep them comfortable and ensure they have the best possible quality of life. This phrase reassures families that the focus is on the patient's comfort. We'll discuss any changes in their condition with you immediately. With this phrase, you are keeping families informed to build trust. If there's anything you need during this time, please don't hesitate to ask. It's important to make families feel supported and included. We can provide emotional support to help you cope with the challenges of caring for a loved one. Here we are addressing the emotional toll caregiving can take on families. It's important to take care of yourself as well. We're here to help you through this process. With this phrase, you're encouraging family members to prioritize their well-being too. We will work with you to ensure your loved one's care plan is in line with their wishes. Here we are highlighting the importance of respecting the patient's wishes and family input. Palliative care often involves discussing different treatment options with patients and families. Let's go over phrases you can use to help navigate these conversations. We will focus on treatments that improve your comfort and manage your symptoms. Here we are reassuring the patient that treatments are aimed at making them feel better. Certain treatments may no longer be necessary, but will keep you informed about your options. This phrase helps ease concerns about discontinuing treatments by emphasizing patient choice. We'll discuss any changes to your treatment plan with you and your family. Keep communication open to reduce patient anxiety. Our priority is your comfort, so we'll adjust your medications as needed. This phrase ensures that patients know that their treatment is flexible. We'll focus on pain management and relieving any symptoms you may be experiencing. Here we are emphasizing the importance of addressing pain and symptoms. We'll discuss the benefits and side effects of each treatment option. Provide clear information to help patients make informed decisions. If you experience any discomfort, please let us know so we can make adjustments. Encourage patients to communicate openly about any discomfort, ensuring they feel empowered to request changes. You may choose to stop certain treatments if they no longer improve your quality of life. Reassure patients that it's okay to make decisions based on their comfort. It's important to focus on what makes you feel better day to day and will help guide you through those decisions. Help patients feel supported in making choices about their care. Your care plan will be regularly reviewed and updated based on how you're feeling. Ensure patients that their care is adaptable and regularly assessed. In palliative care, you may encounter difficult situations with patients or family members who are upset, confused, or resistant to care. Here are some phrases to help navigate those challenging conversations. I understand that this is a difficult time, and we're here to support you. Acknowledge the difficulty of the situation and offer emotional support. It's okay to feel frustrated or upset. We're here to listen and help you however we can. Validate the patient's or family's emotions to build trust. We want to work together with you to make sure your loved one is as comfortable as possible. You can use this phrase with family members to emphasize the collaborative nature of the care process. I hear your concerns, and I'll make sure to communicate them with the rest of the care team. Show that the patient's or family's concerns are being taken seriously and will be addressed. Let's take a moment to discuss any questions or worries you have about the care plan. Here we are creating a space for open discussion and addressing confusion. We understand that this is overwhelming, and we're here to walk you through every step. Provide reassurance that they won't be left to navigate the situation alone. It's important that we work together to find the best way to care for your loved one. Encourage collaboration between the care team and the family. We are committed to providing the best care possible, and your input is valuable. Here we are reassuring families that their thoughts are an important part of the process. I understand that this is a stressful time, but we are here to help in any way we can. With this phrase, we are acknowledging the stress and providing emotional support. Let's discuss any changes you'd like to see, and we can explore our options. Offering options helps to de-escalate situations by giving the family some control. Next, we'll cover phrases for the end of life stage, when it's crucial to provide clarity and comfort for both patients and their families. We will do everything we can to ensure that you are comfortable and pain-free. Focus on comfort as the top priority. At this stage, the goal is to manage symptoms and provide emotional and physical comfort. Clarify the shift from curative treatment to comfort care. We will be closely monitoring you to make sure any pain or discomfort is addressed immediately. Reassure patients that they will be cared for attentively. It's okay to talk about any fears or worries you might have. We're here to listen and support you. Encourage open dialogue about end-of-life concerns. We'll focus on the things that matter most to you in these moments. Help patients feel empowered in making decisions about their care. You are not alone. Your care team and family are here to support you. With this phrase, we are reassuring patients that they are surrounded by support. We will help you and your family through every step of this process. With this phrase, we are emphasizing the presence of support for both the patient and their family. Our goal is to make this time as peaceful as possible for you and your loved ones. Reassure patients that their peace and comfort are a priority. We're here to answer any questions you may have about what to expect in the coming days. Offer information to ease anxiety about the unknown. If you feel any discomfort or fear, please let us know immediately so we can help. Encourage patients to speak up about their needs. As patients near the end of life, communication shifts toward offering comfort and ensuring peace. Here are some phrases to help guide those conversations. We're here with you, and we'll do everything to keep you comfortable. Reassure patients that they are not alone in their final days. You are surrounded by people who care deeply about you. Focus on the emotional support available to the patient. It's okay to rest now. We'll take care of everything. Give permission for the patient to let go and rest. We'll be here to support your family through this difficult time. Reassure the patient that their loved ones will be cared for. You've been so strong, and now it's time to rest. Here we are offering comforting words that acknowledge the patient's strength. You are safe here, and we will do everything to ensure you feel peaceful. Reinforce the idea of safety and peace. We're here for you, and we'll stay by your side through everything. Assure the patient of constant support. It's okay to let go if you feel ready. We're here with you. With this phrase, you are offering compassionate permission for the patient to pass when they feel ready. We're here to keep you comfortable and at peace, surrounded by love. Emphasize comfort and the presence of loved ones. We will honor your wishes and keep you at peace. Here we are reinforcing that the patient's wishes will be respected. After a patient passes away, communicating with family members requires great sensitivity. Here are phrases to help with sharing the news of death compassionately. I'm so sorry to inform you that your loved one has passed away peacefully. This is a standard and expected way to inform someone of a loved one's death. It has a gentle tone to soften the blow. Your loved one passed away surrounded by care and love. Here we are offering comfort in knowing that the patient was not alone. We did everything we could, and they were peaceful in their final moments. Reassure families that their loved one did not suffer. Please take all the time you need to process this, and we'll be here to support you. Give families space to process while offering ongoing support. We're here to answer any questions you have during this difficult time. Leave the door open for questions to help families cope. It's important to take your time, and we're here whenever you're ready to talk. Reassure families that there is no rush to process the news. We can offer support and resources to help you and your family through this. Here we can point families toward grief resources for further support. Your loved one was cared for with dignity, and we were with them until the very end. Emphasize that compassionate care was provided to the patient. We understand this is a difficult time and we're here to help you in any way we can. Offer practical and emotional support for families. Please let us know if there's anything we can do to help you right now. Ensure families feel supported in the immediate aftermath of the patient's death. After a patient passes away, families often need emotional support to process their grief. Let's go over some phrases to offer comfort and practical support during this difficult time. I am so sorry for your loss. We are here to support you however we can. Here we are leading with compassion and acknowledging their grief. Please know that you're not alone. We are here to offer any support you need. Reassuring the families that they have access to help them during this difficult period. It's okay to feel overwhelmed. We can help you with any next steps. Normalize feelings related to grief and offer practical assistance. We have resources available if you'd like to speak with someone about your grief. If possible, you can offer professional support resources such as grief counselors. Take as much time as you need. We'll be here to help when you're ready. With this phrase, you are giving families permission to grieve at their own pace without feeling rushed. We can help you with the immediate arrangements if you feel ready to discuss them. Offer practical help with post-death arrangements when the family is ready. Your loved one was cared for with respect and dignity at all times. Here you can provide further comfort by reassuring the family that the patient received compassionate care. This is a difficult time, and we are here to provide emotional and practical support. This phrase acknowledges the difficulty of the situation and offers multi-level support. If you'd like, we can arrange a meeting with a chaplain or counsellor for additional support. If possible, you can offer spiritual or emotional support tailored to the family's needs. We'll give you as much time as you need with your loved one before proceeding. Here you can ensure the family feels in control and can take time to say goodbye. Finally, let's look at phrases you can use for follow-up conversations with families and offering grief support in the weeks after a loss. I wanted to check in and see how you're doing. We are here to offer support if you need it. This is a nice way to reach out to families to show continued care and concern. Please don't hesitate to reach out if you need someone to talk to or help with anything. Keep the lines of communication open for families who may need support later. We can provide you with resources for grief counselling and support groups if you're interested. Offering professional help can be a crucial resource for families. If you have any further questions or concerns about your loved one's care, we are happy to answer them. Provide an open door for lingering questions, especially about the patient's final moments. Grief is a personal journey, and there is no right or wrong way to go through it. With this phrase, we are normalizing different grief experiences and give family members permission to grieve in their own way. We understand that this is a difficult time, and we're here to support you as long as you need. If possible, you can offer long-term support, letting families know they aren't forgotten after the initial loss. Would you like us to send over any additional resources on coping with loss? Provide access to grief materials and other support tools when needed. Please know that you are not alone in your grief. We're here to help whenever you're ready. Reinforce that the family has ongoing support available to them. It's okay to reach out whenever you feel ready. We'll be here when you are. Provide comfort by allowing the family to dictate when they're ready for more interaction. Let us know if there's anything we can do to help you and your family during this time. This is a nice way to end a conversation with a broad offer of support to meet their individual needs. And that's the end of our lesson on 100 essential English phrases for nurses in palliative care. Remember, providing comforting, clear communication is key when supporting patients and families in palliative care settings. In this lesson, you will learn 100 English phrases for patient care. This is great for nurses and other healthcare workers. In the world of healthcare, the quality of patient care is paramount. Whether you are a nurse, caregiver, or healthcare assistant, the way you interact with patients can significantly impact their overall experience and recovery. In this lesson, we will explore key phrases and techniques that are essential for providing excellent patient care. We'll cover a range of topics, including morning activities, bathing and bathroom, toilet assistance, emotional support, encouraging mobility and exercise, communication with family, and transitioning care. Each section will provide you with practical sentences and tips to improve your communication and caregiving skills. By mastering these key phrases, you'll be better equipped to create a positive and supportive environment for your patients. Our first topic is morning activities. Good morning, how are you today? Good morning, how are you today? Hello, I'm Jer, your nurse for today. Hello, I'm Jer, your nurse for today. Hi there, nice to see you again. Hi there, nice to see you again. How did you sleep last night? How did you sleep last night? I hope you had a restful night. I hope you had a restful night. Would you like help getting dressed? Would you like help getting dressed? What would you like to wear today? What would you like to wear today? Let's get you into some fresh clothes. Let's get you into some fresh clothes. Can I assist you with your shoes? Can I assist you with your shoes? Do you need help with your buttons? Do you need help with your buttons? Let's move on to our next topic, which are phrases for bathing and the bathroom. Would you like a bath now? Would you like a bath now? I'll help you get to the bathroom. I'll help you get to the bathroom. Do you need assistance with your bath? Do you need assistance with your bath? Let's get you freshened up. Let's get you freshened up. I'll help you with your hygiene needs. I'll help you with your hygiene needs. Is the water temperature okay? Is the water temperature okay? Do you need help getting in or out of the tub? Do you need help getting in or out of the tub? Would you prefer a shower instead? Would you prefer a shower instead? I'll assist you with washing. I'll assist you with washing. Let's make sure you're comfortable and clean. Let's make sure you're comfortable and clean. Next up, we have some English phrases you might use to help a patient to use the toilet. Do you need to use the bathroom? Do you need to use the bathroom? I can help you get to the toilet. I can help you get to the toilet. Let's take a trip to the bathroom. Let's take a trip to the bathroom. Do you need assistance with your clothing? Do you need assistance with your clothing? I'll be here if you need help. I'll be here if you need help. Would you like some privacy while you use the toilet? Would you like some privacy while you use the toilet? I'll help you wash your hands afterward. I'll help you wash your hands afterward. Let's make sure you're comfortable on the toilet. Let's make sure you're comfortable on the toilet. Do you need help getting up? Do you need help getting up? I'll assist you back to your bed or chair. I'll assist you back to your bed or chair. Well done, you're doing great. You've already learned 30 English phrases. Next up, we have English phrases relating to giving medication to a patient. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Do you have any allergies? Do you have any allergies? Let's take your pills with some water. Let's take your pills with some water. This is your medication for today. You could add in the name of the medication here. This is your aspirin for today. I'll check on you after you take your meds. I'll check on you after you take your meds. Let me explain what this is for. Let me explain what this is for. Please let me know if you feel any side effects. Please let me know if you feel any side effects. Remember to take this with food. Remember to take this with food. Do you need a reminder for your next dose? Do you need a reminder for your next dose? Our next topic is phrases related to meals and feeding. It's time for breakfast. It's time for lunch. It's time for dinner. Can I help you with your meal? Can I help you with your meal? What would you like to eat today? What would you like to eat today? Do you have any dietary restrictions? Do you have any dietary restrictions? Let's make sure you're getting enough nutrients. Let's make sure you're getting enough nutrients. Would you like some water or juice? Would you like some water or juice? Are you enjoying your meal? Are you enjoying your meal? Can I help you with your utensils? Can I help you with your utensils? Let me know if you need more to eat. Let me know if you need more to eat. I'll check back in a bit to see how you're doing. I'll check back in a bit to see how you're doing. Our next topic covers phrases related to helping patients with their feelings. Emotional support. How are you feeling today? How are you feeling today? Would you like to talk about anything? Would you like to talk about anything? I'm here to listen if you need to talk. I'm here to listen if you need to talk. It's okay to feel the way you do. It's okay to feel the way you do. How can I make things better for you? How can I make things better for you? You're doing a great job. You're doing a great job. Let me know if you need some quiet time. Let me know if you need some quiet time. Would you like to speak with a counselor? Would you like to speak with a counselor? I'm here to support you. I'm here to support you. Take your time. I'm here for you. Take your time. I'm here for you. These phrases are going to be very useful to any nurse or healthcare worker. Next up, let's take a look at some conversation starters. These phrases are really useful when you want to get to know your patient a bit better. What's your favorite book? What's your favorite book? Do you enjoy any hobbies? Do you enjoy any hobbies? Tell me about your family. Tell me about your family. What kind of music do you like? What kind of music do you like? Have you travelled much? Have you traveled much? What's your favorite movie? What's your favorite movie? Do you have any pets? Do you have any pets? What was your profession? What was your profession? Tell me about your childhood. Tell me about your childhood. Do you have any favorite recipes? Do you have any favorite recipes? We are certainly working our way through our 100 English phrases for patient care. Our next topic is encouraging mobility and exercise. Let's go for a short walk. Let's go for a short walk. Would you like to do some stretches? Would you like to do some stretches? It's important to stay active. It's important to stay active. Can I help you with some exercises? Can I help you with some exercises? How about a walk around the hall? How about a walk around the hall? Let's do some gentle movements. Let's do some gentle movements. Do you feel up to some physical activity? Do you feel up to some physical activity? I'll assist you with your exercises. I'll assist you with your exercises. Let's work on your strength and mobility. Let's work on your strength and mobility. We can take it slow and steady. We can take it slow and steady. Our ninth topic is communication with family. Would you like to call your family? Would you like to call your family? Can I help you video chat with your loved ones? Can I help you video chat with your loved ones? Do you want me to update your family on your condition? Do you want me to update your family on your condition? Is there a family member you'd like to speak with? Is there a family member you'd like to speak with? I can assist with arranging a visit. I can assist with arranging a visit. Let's keep your family informed. Let's keep your family informed. Would you like to write a letter or email? Would you like to write a letter or email? I can help you send a message. I can help you send a message. Is there anything you want me to tell your family? Is there anything you want me to tell your family? I'll make sure your family knows how you're doing. I'll make sure your family knows how you're doing. And now we are at our final topic, In this segment, we'll learn phrases for communicating about the end of our shift and transitioning care to another nurse or healthcare worker. My shift is ending soon. My shift is ending soon. I'll introduce you to the next nurse. I'll introduce you to the next nurse. Is there anything you need before I go? Is there anything you need before I go? I've informed the next nurse about your needs. I've informed the next nurse about your needs. I hope you have a restful night. I hope you have a restful night. I'll be back to check on you tomorrow. I'll be back to check on you tomorrow. Thank you for allowing me to care for you. Thank you for allowing me to care for you. I'll make sure the next nurse knows your preferences. I'll make sure the next nurse knows your preferences. Please let the night nurse know if you need anything. Please let the night nurse know if you need anything. It's been a pleasure taking care of you. It's been a pleasure taking care of you. Well done, you've just learned 100 English phrases for nurses and healthcare workers for patient care. You've done a fantastic job. Hi everyone, welcome back to Learning English Pro. My name is Jerry, your English tutor and guide. In today's lesson, we'll be diving into advanced medical English for mental health communication. This lesson is especially useful for nurses and other healthcare professionals who want to improve their communication skills in sensitive mental health situations. In this lesson, we'll cover essential communication skills for when discussing mental health with patients. You'll learn key phrases for initial assessments and strategies for handling sensitive topics such as anxiety, stress, and feelings of isolation. By mastering these approaches, you'll enhance your ability to build trust and provide compassionate care in challenging situations. So if you're ready, let's get started. In mental health care, using the right language is crucial to support, comfort, and guide patients through difficult conversations. Let's start by learning essential phrases that can help establish trust and understanding. Can you tell me more about how you've been feeling lately? When did you first start feeling this way? Would you like to talk about what has been on your mind recently? Have you experienced these feelings before, or is this new for you? What do you think might be contributing to how you're feeling right now? These phrases are all great for initial assessment of mental health care patients. Let's take a look at some phrases for showing empathy and support. I'm here to listen and support you. Your feelings are valid. It's okay to feel this way, and we'll work through this together. You're not alone in this. There are people who care and want to help. I appreciate your courage in sharing how you feel with me. It sounds like you've been going through a lot. I'm glad you're speaking up about it. Remember, using these phrases can help you open the conversation gently and make patients feel heard. Remember, in mental health care, it's not just what you say, but how you say it. Use a calm and reassuring tone. Now let's look at how to address more challenging aspects of mental health care. Sometimes patients may express thoughts or feelings that are difficult to respond to. Here are some key strategies. I can see that you're feeling anxious. Let's take a deep breath together and we can talk more about what's worrying you. It's understandable that you're feeling stressed. Would you like to share what's been making you feel this way? Anxiety can be overwhelming. Are there particular times of day or certain situations that make it worse? The next few phrases can be used when a patient mentions feeling overwhelmed. It sounds like everything is becoming too much to handle right now. Let's break things down and talk about what's troubling you the most. You don't have to carry all of this alone. We're here to support you in finding ways to manage these feelings. Let's focus on one step at a time and see what feels most manageable for you. If a patient mentions isolation or loneliness, the following phrases can be useful. I understand that feeling alone can be very difficult. Have you considered reaching out to a close friend or family member, or would you like us to explore some support groups together? Would it help if we talked about ways to stay connected with others, even in small ways? It's natural to feel isolated at times, but there are resources and people who can help bridge that gap. Next, we have some phrases for addressing statements about depression or hopelessness. Thank you for sharing this with me. It's important to talk about these feelings so we can find the right support. I hear that things feel overwhelming right now. Let's discuss some strategies or people you can talk to who can support you through this. Your well being is important. Would you like to talk more about this so we can explore some options together? These responses show empathy while encouraging patients to open up further or think of actionable steps to improve their situation. Encouraging patients to reflect on their emotions and take positive action is another important part of mental health support. Here are some phrases and techniques. What are some things that usually help you feel better, even just a little? Have you noticed if there are certain situations or activities that improve your mood? Can you think of times when you felt more in control? What was different then? Reflecting on small victories can be really powerful. Is there anything that went well recently? Our next batch of phrases are useful when you're suggesting steps forward. Would you be open to trying some relaxation techniques or activities that you enjoy? Let's think of one small thing you could do today that might help you feel better. There are some self care strategies that might be useful. Would you like me to share a few ideas? Would connecting with a mental health professional be something you consider? We can help find someone who fits your needs. And lastly, let's take a look at some phrases that can help to empower the patient. Remember, it's okay to take things at your own pace. Progress is still progress, no matter how small. You have shown so much strength by talking about this. Let's find ways to build on that strength. Taking the first step can feel hard, but I'm here to help you figure out the next steps. Thank you for joining me in today's lesson on Advanced Medical English for Mental Health Communication. Remember, showing empathy, listening actively, and using a supportive language can make a huge difference in how your patients feel during difficult times. You're very welcome to today's lesson where we'll be focusing on key phrases and questions when diagnosing patients. This lesson is designed to help you conduct professional and clear medical consultations in English. Let's get started. It's key to understand the diagnosis process. The questions you should ask should cover several areas. The chief complaint. What is bothering the patient the most? The onset. When the symptoms started. The severity, how serious the symptoms are, and the history, any previous medical issues or treatments. Now that we've broken down the diagnosis process, let's dive into some key phrases that you can use to ask your patients the right questions. First, you need to understand the patient's main problem. These phrases will help you ask about their chief complaint. What brings you in today? This is a simple way to ask what the patient's main issue is. Can you describe your symptoms? This is a common phrase to get the patient to talk more about their condition. What seems to be the problem? This is another way to ask about the patient's main concern. How long have you had these symptoms? You can say this when you want to understand the timeline of the patient's symptoms. When did you first notice this? This is a great follow-up to pinpoint the onset of the problem. These questions help you get to the heart of the patient's problem, so you can start narrowing down potential diagnoses. Next, it's important to gather more information about when the symptoms began and how long they've lasted. Here are some useful phrases. When did the symptoms start? This is a direct way to ask when the patient first experienced the issue. Did the symptoms come on suddenly, or have they developed over time? This helps determine whether the issue is active or chronic. Has the pain been constant, or does it come and go? Understanding the pattern of the symptoms is essential for diagnosis. Has it gotten worse over time? Useful for tracking the progression of the problem. Are the symptoms better or worse at certain times of the day? This phrase helps identify triggers or patterns. Knowing when and how symptoms began gives you a clearer picture of what might be causing the patient's condition. If the patient is in pain, it's important to assess the severity. These phrases will help you understand how serious the pain or discomfort is. On a scale of 1 to 10, how would you rate your pain? This is a common way to get a numerical assessment of pain levels. Is the pain sharp, dull, or throbbing? This helps to understand the type of pain the patient is experiencing. Does the pain spread or radiate to other parts of your body? This is useful for identifying conditions that affect more than one area. What makes the pain better or worse? This question helps determine if any activities or medications affect the symptoms. Have you taken anything for the pain? Has it helped? It's important to know if the patient has already tried treatments and what the results were. Assessing the severity and type of pain is crucial for diagnosing conditions accurately and recommending the right treatment. Understanding a patient's medical history and lifestyle is also critical to diagnosing their condition. Here are some key questions to ask. Do you have any pre-existing medical conditions? This question helps identifying underlying health issues that could be related to the current symptoms. Are you currently taking any medication? Knowing what medications the patient is on helps avoid drug interactions and can explain certain symptoms. Have you had any recent surgeries or treatments? Past procedures can provide clues to the current issue. Do you smoke or drink alcohol? Lifestyle factors can impact health significantly, and this question helps identify potential risk factors. Has anyone in your family had a similar condition? Family history is important, especially in cases of hereditary conditions. Getting a full picture of the patient's medical history and lifestyle ensures you don't miss any important details in your diagnosis. Once you've gathered all the necessary information, it's time to wrap up the consultation. Here are some phrases to close the conversation professionally. Based on what you've told me, I'd like to run some tests to get a clearer picture. This phrase signals the next step in the diagnostic process. I'm going to refer you to a specialist for further evaluation. If you think the patient needs additional care, this phrase is useful. Let's schedule a follow-up appointment to monitor your condition. It's important to ensure ongoing care by arranging a follow-up. Please let me know if your symptoms change or get worse. This encourages the patient to keep you informed of any developments. Thank you for coming in today. We'll stay in touch with your results. This is a polite and professional way to close the appointment. Ending the consultation in a clear and professional manner helps maintain patient trust and ensures they know the next steps. And that's it for today's lesson on diagnosing patients in English. I hope these key phrases and tips help you feel more confident during your medical consultations. Don't Today we're tackling one of the most difficult aspects of healthcare, delivering bad news to patients. As healthcare professionals, breaking bad news requires not only medical knowledge, but also sensitivity and empathy, especially when communicating in English. In this lesson, I'll teach you key phrases and strategies to help you deliver tough news with compassion and professionalism. We'll cover how to set the tone, deliver the news clearly, and respond to emotional reactions from patients and their families. Let's get started. Before delivering difficult news, it's crucial to set the tone and prepare the patient for what's coming. Here are some phrases you can use to begin the conversation with care and professionalism. I'm afraid I have some difficult news to share with you. This phrase is a direct but sensitive way to introduce the conversation. Before we begin, I want to make sure you feel comfortable asking any questions you may have. With this phrase, you're encouraging open communication and making the patient feel heard. This is not an easy conversation, but I want to be as clear and supportive as possible. Here we are acknowledging the difficulty of the situation while showing empathy. Once you've prepared the patient, it's important to deliver the news clearly and directly, without being abrupt. Let's look at how to phrase this carefully with some examples. Unfortunately, the test results show that the condition is more serious than we initially thought. This phrase is a compassionate way to introduce the severity of the condition. I'm very sorry to inform you that the cancer has returned. Here we are delivering the news with a clear and compassionate tone. We've explored all possible options, but the prognosis is not as positive as we had hoped. And here we're balancing honesty with empathy when discussing a poor prognosis. I know this is hard to hear, but we need to discuss the next steps moving forward. With this phrase, we are transitioning from delivering the news to discussing future actions. When patients receive bad news, they often react emotionally. It's important to remain calm, offer support, and give them space to express their feelings. Here are some phrases you can use in these moments. I can see this is very overwhelming for you. Please take your time to process what I've said. With this phrase, we are acknowledging the patient's emotional response and giving them space. It's completely normal to feel this way. I'm here to answer any questions you might have. Here we are validating the patient's emotions and offering continued support. I understand that this is difficult news, and I want to make sure you feel supported every step of the way. Here we are offering reassurance and emphasizing your role in their care. If you'd like, we can take a moment before we discuss the next steps. With this phrase, we are suggesting a pause to give the patient time to compose themselves. Once the initial shock of the news has passed, patients will often want to know what happens next. Here are some phrases to help you guide that conversation. We can discuss the treatment options available to you when you're ready. With this statement, you're allowing the patient to choose when they want to move forward with the conversation. There are several ways we can manage your symptoms and make sure you remain comfortable. Here we are offering reassurance about symptom management and patient comfort. I'll be working with a team of specialists to ensure you receive the best possible care moving forward. Here we are offering more reassurance and letting the patient know that they will receive ongoing support from a team. We'll schedule a follow-up appointment to review the treatment plan, and you can always contact me with any questions in the meantime. With this phrase, we are providing a clear path forward and encouraging open communication. It's not just about delivering the news and discussing treatment. It's also important to provide emotional support and encouragement. Here are some ways you can offer that support. I'm here to support you, and we will work through this together. With this statement, you are offering reassurance by emphasizing partnership in care. Please know that you're not alone in this. We have resources and support available to help you through this difficult time. Here we are offering more emotional and practical support to the patient. I know this is overwhelming, but we'll take it one step at a time. And here we're helping the patient focus on manageable next steps. If you ever feel unsure or need someone to talk to, please don't hesitate to reach out. With this phrase, you're encouraging the patient to lean on you for guidance and support. That's it for today's lesson on delivering bad news to patients. If you found this lesson helpful, please subscribe to Learning English Pro for more lessons tailored to healthcare professionals. Feel free to share this video and guide with your colleagues. Thanks for learning with me, and I'll see you in the next lesson.